Okay, my name is Dr. James Perkins. I'm a chiropractor and a naturopath. I've been in practice for 30 years, and one of the techniques I love to employ on a daily basis is the Cox flexion distraction table. So I'm going to demonstrate that for a couple minutes here. I'm going to explain what it is, why it, in my opinion, is more superior than a lot of decompression moves. And so the flexion distraction table was developed by Dr. James Cox and Dr. McManus, and it was developed primarily to take care of herniated disc. However, it has no contraindication. You can use it on even compression fracture of the spine. It works wonderfully to decompress. My patients absolutely love it when they have herniated disc. I have helped hundreds of people over the last 30 years to keep away from surgical procedure and drugs for their low back. And we have fixed them, and they lead nice, healthy, happy lives. And it alleviates sciatic pain, it alleviates low back pain, and it is a wonderful adjunct to any other physical therapy that patient's using. The flexion distraction table is performed by the practitioner in an attended fashion. That means this is not unattended traction. Typical physical therapy traction, typical medical traction is done with the patient on their back with a harness around their pelvis and a harness around their chest and thoracic area with cables and a winch pulling the body apart. That's axial traction. I'll demonstrate that in a minute. It has very little value. It's very expensive, very time consuming. This is very comfortable. This is very less expensive and certainly less time consuming. And I will show you now basically how we're going to do this. Simply the patient is face down on the table, not face up. That brings a more comfort into the movement here. So here we have Bill on the table, and we're going to do a little stretching on his low back to try to open up the motor unit. Now the motor unit is the vertebra above and below with a disc in the middle and nerves coming out, and that motor unit is literally sitting in fluid. The nerves leading into that area are extensive, but the blood supply is not. So that fluid needs to be constantly moving in there, and that's what this table does. So go ahead and just zero in on this, and I'm going to show how we do this. The table is stretched out right now, and I have Bill kind of secured in here a little bit. And there's springs here, and there's kind of a universal joint down in here, so I can move this like this. So here's the way we do this. We get onto the motor unit at L5, S1, and we just stretch this out. For most people, it's very comfortable. And for Bill, it's comfortable. He likes it. He's told me he feels very comfortable doing this. We can also move side to side. We can also circumduct in a circle, which is wonderful for helping to suck the nucleus pulposus back into the motor unit. It brings the blood, it brings the spinal fluid, it brings all the water, it brings everything into that unit, and it milks that disc, and it opens it up and allows it to heal. This is very dynamic. It doesn't take a long time. I do this for a couple minutes, maybe 3 minutes, 4 minutes, 4, 5, 6 times. And each time I do this, the patient gets better and better until eventually I can do this. I can go right down here. So go ahead and let's conclude this. Bottom line is, you have low back pain, you have problems with your back, you've been told you have bulged disc, herniated disc, spondylolisthesis, you must try this table. Please go to my-alternativehealth.com for more information on that. And look for a practitioner who uses Cox distraction, flexion table. These tables are marvelous, and I know you'll get results. Call today, 248-855-8707. Thank you.